Hello doctors, my name is Dr. Naseera Abdul Hameed, and in today's video we'll be discussing how to identify skin types. In the last video we had discussed about the anatomy and physiology of the human skin in relation to facials. And in that video I had discussed how to get the best result in especially when you do facials. Two things are very important. First one is to identify the correct skin type, and the second step is to select the correct ingredients according to skin type. So by identifying the correct skin type and customizing the according to the patient's needs, that we will get good results, especially in facials. Now, I believe the whole theme of my classes is customization, which is basically based on Ayurveda, right? So in this class, we'll be dealing about the different types of skin. And once you have, this is actually quite an easy topic. And once you have a good grasp about this, how to identify the skins, then the next video we'll be discussing about how to select the ingredients. Now, this is, as mentioned before, is a very simple process. I'll be showing a few pictures. I'll be showing a few slides today. So we'll be discussing how to identify a patient's skin type. Now, basically, there are five kinds of skin, which is of normal skin, oily skin, dry skin, combination, and sensitive skin. So let's deal each type of skin in detail. We'll be discussing how points of how to identify them, and especially in cases like oily, dry, and combination skin, we'll be discussing why the skin is like that in a particular way. Now let's start with the normal skin. Please look at the picture. Here you can see, the patient, the person has, quite a good, healthy looking skin. And these are the features of normal skin. Now, on a physiological point of view, it has normal oil and sweat production, which means, it's not too dry, it's not too oily. It has a balanced moisture content, which means skin is like hydrated at all times, and it has a normal cell cycle with proper cell shedding. In the last video it had discussed about cell turnover cycle, and in normal skin, the cell turnover cycle is usually a month. So because of the shedding, the skin looks quite fresh and glowing. I had discussed all the points in the last video. Now, this is a very interesting point. The pores are barely visible. Okay. So normally we have this concept that, in normal skin, there won't be any texture, there won't be any pores. But the reality is that, normal skin does have pores, but they're just very, very barely visible. They will, if you look, very closely, yes, you can see the pores and you can see a texture. Please tell patients that some patients come to us, very worried. Just tell them, seeing small visible pores is not a big deal, especially when it comes to normal skin. Now, summing all these points up, we can say the skin is smooth and radiant. So if you have normal skin, or if a patient, if a person has normal skin, we can say that they have hit the genetic lottery or the genetic jackpot, because that is the best kind of skin you can have. And another very important feature to this kind of type of skin is that it does not react adversely to any kind of product. So this is basically normal skin. If you have normal skin, good luck for you, good for you. If the patient has a normal skin, again, good for you, because usually what I see in my clinics is that people who have normal skin, when they come to do any procedures, they are the people who see the best results. Okay, now let's move on to the next type of skin, which is dry skin. Please look at the picture. You can see, this is the kind of, the what do you say, presentation when people come with the dry skin in the OP. And let's see the reason for dry skin. Let us say that skin that produces less sebum than normal skin is called dry skin. Now, how is sebum produced? Normally, lipids, in the forms of ceramides, in the form of cholesterol and fatty acids, present in the stratum corneum. All of these have this common function of retaining the moisture and prevents a protective barrier against external agents. Now, when we speak about the physiology of skin, it is known as the first line of defense in the human body, right? So, the lipids have this, major function of protecting the skin. And there are again factors called NMFs, which are natural moisture factors. For example, there are lactic acid, amino acids, and urea, which what these natural moisture factor does is that they help to bind water into the skin. So what happens in people with dry skin, they naturally lack lipids and they naturally lack NMFs. Okay, so again, and speaking from my clinical experience, people with dry skin, actually, when they come to you, they say, my skin is too dry. There is actually no cure for dry skin. The only thing is that you can give constant hydration to the skin. Keep on giving constant hydration to the skin. Be careful during the winter months. If they need any internal medications, give it to them. But when we do what do you say, facials in people with dry skin, just make sure that you give a very moisturizing ingredients to them. Don't worry, we'll talk about the ingredients in the coming videos. How to identify dry skin now? This is the most common questions which I get from my students. Now, you should be able to, when a person comes to your OP, you should be able to, sit in your chair and be able to identify your skin. And these are the characteristic features which you see in people with dry skin. First is what they tell is, my skin is very dry, and my skin is very rough, doctor. That is the first thing they tell you. Next thing, very very important, in people with dry skin, they will, no visible pores will be there. What normally we think is people with normal skin don't have pores. It is actually people, they do have pores, their pores won't be visible. The skin appears lustreless and blotchy because there is this loss of there is no what you can, in Ayurveda you can say, no sneha present. From an Ayurveda perspective, there is no sneha present over there. The skin appears very, there is rukshata factor is too much. It appears lustreless and blotchy. Blotchy means, you can see patches of white patches on your skin, right? Yeah. And fine lines may be visible. Dry skin is the skin which ages the fastest. So because of the lack of hydration, a lot of fine lines, a lot of wrinkles can appear in the skin very fast. And another common thing which they say is that, doctor, my face which feels itchy all the time, because skin is kind of stretched all the time. The face feels itchy, and the skin may be flaky. Okay, another common thing which they show you is, they show your hand and they say, like, draw a line, and a white line appears. The skin may be, that is flakiness of the skin. Okay, and the skin may be flaky when you run your hands over it and it turns white. And the most common thing what they tell is, after washing your face, they tell, even if with water, they tell, you wash my face feels stretched and tight. This is the most common features of dry skin. You can say these are, dry skin as a vada predominant, not totally vada, but it will be vada predominant skin. And the most important things which we can give them is sneha, or we can give them lotions, creams, whatever it is. A lot of options are available in the market, especially when you do facials in skin, people with dry skin. You can give a lot of steam. But make sure that you don't scrub the patient too much. We'll be discussing that in the steps of facials. Now, next one is oily skin. Please look at the picture. Have an understanding of what to expect when you can see the picture. And now okay. So this is oily skin occurs when the sebaceous glands in the skin are hyperactive and oil. Sorry, produce excessive sebum in the skin. All of us as doctors, we know that. And because of the hyperactive sebaceous glands, the skin becomes oily. And they say basically there are 4 factors, okay, for oily skin. It can be genetic. Your parents can have oily skin. Parents can have acne-prone skin. Definitely, you are at higher chance to have that. Another one is hormones. Conditions like PCOD, PCOS, hypothyroidism, and all. You see, because of hormonal variations, because of the increase of androgens in the body, you can see acne. Stress is another very big factor. because I have patients who have told me like my acne flares up, or I get, my skin is usually okay during exam times. I have these big pimples like boils in my face. And the reason for stress causing acne is because when you are stressed, the adrenal gland in our body will produce cortisol. Now cortisol has a property to increase sebum production, which in turn will cause acne in the face. And certain medications, I've had patients who tell me, doctor, my skin was totally clear, and I sudden all of a sudden. So I asked them, have you started any medications? So the usual feedback which I get is, yes, I started. And when you look at what medicines they're taking, it will be usually corticosteroids most of the times. Not for everyone, but some people have issues with that. So certain medications. So these are the causes. A lot of causes are there. Even a person with oily skin or a person with acne prone skin comes to you, most importantly, you have to try to identify the cause for oily skin. Only then we find the nidanam and we treat the nidanam, and we prevent the nidanam. Only if then we'll get good results. And one more point which I wanted to add, especially when it comes to oily skin, when the genetic factor. I have teenagers who tell me, if this is genetic, it will go away. Yes, oily skin acne usually goes away on its own when a patient is whenever a person is around 20, 21, 22 years old. Usually it goes away on its own. It is very good if you take treatment. Acne has this tendency to leave acne scars. Okay, and it causes PIH, post-inflammatory hyperpigmentation on the skin. But the effect of early intervention is that once the acne goes away, you won't have any scars, you won't have any hyperpigmentation on your face. So this is something which you should know, and this is something which you should educate your patients. I have so many teenagers asking me, doctor, I know this will go away, but why should I take the treatment now? So this is something you have to keep in your mind. Now, how to identify oily skin? When oily skin, skin feels greasy. Greasy means oily. They always tell, my face is always oily, and the skin looks shiny all the time. So this is a very good indicator for you. When they come and sit on you, when sit in front of you, you get this very shiny, shiny face on them. You can understand, yes, it is oily skin. They tell how much ever I wash my face, how much I wash my, after 1 hour, there's still oil in my face. And this there are large pores on the surface of the skin. Now, large pores, people come to us just because of the pores, because the pores make them, this is aesthetic component to pores, which makes them uncomfortable. So, large pores is a typical feature of oily skin. And people with oily skin are more prone to develop blackheads and whiteheads and large pimples. We have to understand, people with oily skin always need not have acne, but they are more prone to acne than regular people. A combination skin. Combination skin. Now, what is combination skin? Comprises of an oily T-zone, while the rest of the skin is either normal or dry. What are the causes for T-zone? Now, this is a very, especially when it comes to facials, using T-zone, selecting the drugs with combination skin is quite tricky. So let's see the causes. Oily T-zone is caused by an oversecretion of oil or sebum in the particular area. This is the T-zone. So let us describe the T-zone is the forehead, nose, and chin. Okay. Lack of sebum. So this area. Okay, this is the T-zone. Okay, they say this is the V zone. Okay, this is usually the cheeks. The oily T zone is caused by an oversecretion of oil. And this V zone can be normal, or it can be dry. It can be dry because of lack of sebum or oil, and a corresponding lipid deficiency in the cheeks and chin can cause dryness in remaining parts. Now, the thing with combination skin is it's quite tricky. Oily skin can be considered as kapha predominant. So this comes vata kapha, but it can be oily and it can be dry. So selecting the drug is very important. We'll be discussing, and that we have to be very careful also, because if we what happens if especially when it comes to facials, when it comes to combination skin, you'll try to dry out this area because this is oily skin. So if you use the same drug over here, what happens is, here the oil may go, but here what happens, may become dry, which is, which won't be comfortable for the patients, or patients won't get the glow that they had intended to, to get when they came to us. So yes, there are a lot of drugs which can help with combination skin. Now let's see how to identify them. How to identify combination skin? The skin feels normal to dry. We understood about normal and dry in the cheeks, but it is always oily in the T-zone. Okay, acne or blackheads occur in the foreheads, nose, and the chin. And the large visible pores are visible only on the nose. Usually, what happens is people with oily skin have pores here also, but with people with combination skin only in the usually see in the nose, and the T-zone is always shiny. You have to be able to identify combination skin. So if you identify combination skin, sometimes the skincare can also be tricky. So there are a lot of ingredients, there are a lot of actives which you can use with people with combination skin. There are a lot of single drugs which we can use with people with combination skin, that which we will discuss in the coming videos. Now, this is the last step of skin which we are dealing today. Please look at the picture. What is the first thing you can see? The first thing you can, I think, this is the redness of the face, right? Now, sensitive skin is easily irritated by different factors such as climate, skincare products, and cosmetics that are generally tolerated by normal skin. Please keep in mind climate, skincare products, and cosmetics. This is the most common thing. You know what, people, you don't need to see a patient. You don't need to. The first thing they'll come is, doctor, I can't use anything. That is what they tell you. Okay, what happens? They tell you, I can't use a soap. I can't use a soap by which my sister is using. I can't use a cream anyone is using. Understand, it is sensitive skin. Okay, why is the skin becoming sensitive? The effectiveness of skin lipids is dependent on enzyme activity. Remember what I told in the last video, stratum corneum. Okay, the physiology, the anatomy of the stratum corneum, which is the stratum corneum is the first line of defense. Okay, it helps to prevent all the things, from the external environment to inside the body. So what happens is, the effectiveness of skin lipids, which is dependent on enzyme activity, is usually weaker in sensitive skin. Okay, because the enzyme activity is weaker, what happens is all the irritants can easily come inside the skin, and can irritate the epidermis and the epidermis. This allows the irritants and toxins to penetrate easily, causing skin to become compromised very easily. So when it comes to facials, one of the most important thing, don't do facials on sensitive skin. That is the biggest no, because even if you touch the face, the patient, especially if you are steaming the face or if you are scrubbing the face, if you are massaging the face, they will be even very sensitive to the simplest, one of the most simplest things which you can use is chandram powder, right? Sandalwood powder. Some people I've seen, who are even irritated by that. So there's a particular way. Normally, what if sensitive people come, what I do is, if they want to do a facial, I say doing facial is not a good idea. And if you want to do a facial, what I usually recommend people is, if I have this, if they want to do a particular facial, I will give the powders or I will give the creams which I am planning to use in the facials for them to use for around 1 to 2 weeks. I'll tell them, most probably I'll give them a contact number in which they can contact me at the earliest, because if you see any kind of irritation, I'll tell, call me. Or if you stop the medication and come and see me. And once their skin develops a good resistance, or if I see that yes, that they are comfortable with that, I do the facials for them. Most of the time, people with sensitive skin, in my OP, I stand with them. Okay, because in the first two step, maybe no major issues will be there, but once they start steaming, or sometimes I skip the step, that is what I'm saying about customization. So if you have this idea, particular idea of how you want to deal with the patient, if there's this customization in mind, sometimes I tell, skip skip a particular step, or skip the skip the, if you don't have to do every step of a facial, skip a particular step, so that they are able to complete the facial, for their satisfaction. So it is very important. Now let's say how to identify sensitive skin. Usually what they tell is their skin turns red very easily. Usually what patients tell me is that, even with climate change, my skin, all kinds of flares up and turns red. And when there may be swelling, there may be scaling, flaking, roughness, or rashes over the skin, be careful, because all of these can happen when you do facials when you do facials without any concentration on a person with sensitive skin. Swelling can come, scaling can come, flaking, roughness, or rashes over. It can happen. It happens to me sometimes, because I had a patient recently who wouldn't tell me anything. I usually asked, "Do you have any reactions?" And we did a high frequency treatment for the patient, and she had swelling for around 2 days. It was swelling went down after she came to me. I had given her medicines, but then after that, I've been very careful. So it can come up unexpectedly. So be very careful. That's what I'm telling you. Especially when you deal with sensitive skin, there may be itching, burning, and pricking sensation. The most common thing which patients tell you is that they have this burning sensation, especially when they're doing the facials. If a patient complains of anything while doing it, stop the facial right away. And what I usually do is give any Shita drug. Usually we'll have aloe vera gel in the clinic. We have rose gel in the clinic. We have rose water. Sometimes multani minty does the trick. Sometimes chandanam does the trick. But you have to have. That's why I told. I stay with the patient. I make sure everything is, because each and every step goes as planned. A person may develop a rash if there is a change in climate, as you told before. And the most common thing they tell you is, "Doctor, I can't even use a powder. I can't use a sunscreen." If I ask them, "Do you use?" They say, "No, I cannot use any kind of sunscreen. I cannot use any cosmetic products." So that is the biggest highlight for sensitive skin. With this, we come to the end of this video. What I have to tell to my dear doctors who are interested in cosmetology, who are interested to do facials, make sure you are thorough. And as an assignment, as in my early days, what I used to do was, you understand the 5 skin types, you look at everybody's face, and kind of try to identify their skin. You can do it with your friends, you can do it with your family. Definitely, patients, you have to do it. And one more common thing, which an inquiry, thing as an inquiry which I get in my OP is, like, people come and sit next to me and say, "Doctor, please identify my skin type." Hmm? They'll have something in their mind. They want to make sure that they are correct. Or we tell them, if I am saying, "Okay, you have combination skin," I have to explain it to them. Why do you have combination skin? Right. So make sure you make these things, grasp these things well. Make sure you understand everything. And in the next video, we'll be discussing about the steps of the facial. Now, this is a very interesting topic. Finally, we are reaching the topic. And with that, we come to the end of the session. Until then, it's goodbye from Team Drona. Thank you.